and welcome to Docplexus News. Union Health Minister JP Nadda has proclaimed that a forum will be developed for the stakeholders to join with the government and make health policy interventions. The decision was taken keeping a note that currently there are no formal structure in the health sector where interactions can be facilitated on policy matters. Recently, the Rajasthan High Court stated that the study of biology is not mandatory to pursue MBBS. This statement was passed as two students who had cleared the NEET exam were denied admission as it did not have biology at higher secondary level. The court further said that these students have already made through the subject by clearing the NEET exam, and so there is no point in denying them admission. AIIMS and IIT Delhi have come together by signing a MOU to develop technology-driven healthcare solutions. The aim of this collaboration is to come up with low-cost technology-driven solutions and develop new equipments for diagnosis and medical testing. This step was taken to promote joint research in academics by combining technological expertise with medical expertise. FDA recently approved Eravacycline, a fluorocycline antibacterial drug for the treatment of complicated intra-abdominal infections in adults. In clinical trials, Eravacycline was well tolerated and achieved high clinical cure rates, having a favorable safety profile. According to FDA, this new treatment would be great benefit to patients with complicated intra-abdominal infections. Dr. Parekh has edited out BRCA1 mutation in a newborn by using pre-implantation genetic testing. 8 years back, a 37-year-old woman discovered that she carried the cancer-causing BRCA1 mutation and was determined not to pass the same to her twin babies. Using this technique, Dr. Parekh transferred the healthy embryos into the woman's womb. The researchers from London demonstrated that antibodies from a toxin secreted by bacteria in acne vulgaris can reduce inflammation and acne lesions. The new vaccine targets the bacteria which is already present in the skin. It can also avoid the potential adverse effects of topical or systemic retinoids and antibiotics. The European Union and India have announced ₹240 crore research projects to develop a next-generation influenza vaccine. For this project, Government of India and European Union have joined together in an ongoing plan called Horizon 2020. The aim of this plan is to develop a cost-effective and affordable influenza vaccine without compromising the quality. The American College of Cardiology and American Heart Association released an updated guideline for the management of adult congenital heart disease. The guideline presents a new classification system which considers the patient's functional status by the presence of cardiovascular and non-cardiovascular problems. This system intends to capture the complexity of the disease in terms of both anatomy and physiology. Recently, Dr. Sharad Paul has received the Kiwi Indian Hall of Fame Award 2018 in New Zealand for revolutionizing skin cancer treatment on a global scale. In 2010, he invented the hollow split skin graft technique. In this technique, partial thickness grafts are harvested from the annulus area around the defect. This technique speeds up wound healing after grafting, restricts the surgical wounds to one site and requires minimal equipment. This ultimately reduces the treatment cost for patients. Docplexus congratulates Dr. Paul for this award. These were the latest happenings in the medical field brought to you by Docplexus, one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!